families, it's Kat Vigo, Doctor of Physical Therapy and founder of Painless Pregnancy, coming to you with some tips about your bony movement during a vaginal delivery. So one thing I want to impress upon you is that your bones in your pelvis move a lot during a vaginal delivery. The other thing I want you to understand is your bones in your pelvis move in a predictable way during a natural delivery. What we can do as women's health PTs, who, by the way, we start out as orthopedic, we know the bones and muscles ad nauseum, then we add the layer of women's health and obstetric knowledge, okay? So we have an extensive understanding of your pelvic floor, your abdominal muscles, as well as your bones, okay? So while you are pregnant, you have a growing baby resting in your pelvic inlet. So that's this space right here. Once you start to go into delivery mode, your baby has to get through your pelvic outlet. So that's this circle down here. These are your sit bones that you can feel if you put your hands on your bum. When you're sitting in a chair, you'll feel those bony prominences. And this is your tailbone. So that baby is going to travel through this lower circle of your pelvis, okay? So that means this tailbone, the sacrum, tips back and typically goes a little bit to the left. And these sit bones come apart as well. So you can see that this is one whole big unit of a bone, okay? So what we do, a service that we provide, is we have really specialized ways, typically we do this laying on your side, to gently mobilize this big bone so that you have maximum unrestricted movement through that joint to allow each side to open and spread and allow that baby to come out through the pelvic outlet. Then we're able to get you either face up or face down in our fancy tables, and we can free up that sacrum to move and rotate and get out of the way as well so that the baby can come on out. And so I spoke in another video about how we help relax the pelvic floor muscles manually with massage and release techniques, cognitive correlation connection to this space. But you can see how if we also mobilize these joints, these bones, where these big, strong, beautiful muscles attach, that will really set you up for success. The other component I don't want to leave out is there are a ton of muscles, soft tissues, ligaments, tendons that come across these bones on the outside. They're hip muscles, glute muscles, all of those. They play a role in how well your joints and bones can move. So once we do our awesome releases to the joints, we immediately follow that up with some soft tissue or massage techniques to all the big hip muscles that attach to those bones. These conservative measures really increase the chances that your body, your muscles, your bones, your pelvic floor, your back, your hips have a successful experience with a vaginal delivery. So if you have any questions about that, or if you want to know more about protecting your pelvic floor and your joints during delivery, please don't hesitate to call. We love talking to new moms. We love calming fears. We love educating. So if there's any way you'd like to chat, we would be happy to be on the other end of that call. Thank you for watching, and we look forward to connecting.